While many personality disorders exist today, little is still known about borderline personality disorder. What is bipolar personality disorder? In 1938, Adolf Stern first tried to describe this disorder as a group of people who didn't fit into either the neurosis or psychosis categories, neurosis being chronic distress without hallucinations or delusions, and psychosis as a loss of touch with reality. The borderline in borderline personality disorder means that this disorder straddles the gray area in between these two categories. Due to its similarities with other dramatic cluster B personalities disorders such as narcissistic, histrionic, and antisocial personality, some question whether borderline personality disorder is valid, as its symptoms contain a mixture of these other previous disorders. For example, histrionic people are vain, exciting, and self-indulgent, while borderline disorder people may also show similar symptoms. Narcissistic people also show lacking of empathy, also shown in borderline personality. And finally, antisocial people can tend to be reckless and impulsive and irritable, another symptom of borderline personality disorder. Similar to having a mixture of symptoms from each cluster B personality disorder, controversy also lies in that 85% of people with borderline personality disorder have a co-occurring disorder, according to the frontiers of human neuroscience. While Adolf Stern in 1938 tried to first describe the disorder, Gunderson and Kolb in 1978 were able to describe the symptoms of borderline personality disorder as absolute despair, unstable self-image, rapid change in mood, fear of abandonment, and hallucinations that help define it in the DSM today. Finally, in 1980, borderline personality disorder was included in the DSM number 3. Today, the symptoms for borderline personality disorder can be outlined in the DSM-5, with 5 or more symptoms being needed for a diagnosis, along with the age limit above 18. Some of the symptoms include a frantic effort to avoid real or imagined abandonment, tending to alternate between extremes of idealization and devaluation of people, meaning seeing people as really good or really bad, an unstable self-image or sense of self, extreme impulsive behavior such as substance abuse, binge eating, and spending, constant or recurring suicidal behavior, gestures, or thoughts, affective instability or intense affect, chronic feeling of despair, and inappropriate intense anger. According to Mental Health America, borderline personality affects up to 5% of the general population today, affecting more women than men. The National Allegiance on Mental Health Illnesses states as high as 75% of those diagnosed are women. While the cause of borderline personality disorder remains controversial today, brain chemistry attempts to describe borderline personality as a result of lessened functions in areas of the brain that control emotional and impulsive control. Lessened functioning in these areas of the brain are possible explanations as to why people with borderline personality disorder have both aggressive tendencies as well as emotional instability. Along with brain chemistry, some point to serotonin as a factor, as there is an inverse relationship between the amount of serotonin in one's brain and aggression control. However, the most commonly accepted cause of borderline personality disorder still remains today that it is rooted in childhood sexual abuse and emotional instability among the parenting of children. One possible cause behind the development of borderline personality disorder is the idea that children were not provided punishments or reinforcements that were suited for the child at the time. For example, if they are never given rewards for showing love, they may have been paranoid or distrusting as an adult. Also, being shown love conditionally is a major factor as it teaches a child to switch between emotions quickly, a defining factor of the illness itself. This can later be shown in life as the idea of splitting. The idea of splitting is putting some people on a pedestal while others are awful. This is the black and white of the borderline personality. This is the good and evil. As seen in this picture, it can be seen that normal people have a wide spectrum of varying emotions. However, people suffering from borderline personality disorder are more black and white with their emotions. As a result of the inconsistent love shown during childhood, often coupled with sexual trauma, many of the people suffering from borderline personality disorders learn to have a severe attachment to others, as a lack of support in the past has made these people in constant need for reassurance today. Borderline personality is more common than some may think. People such as Lindsay Lohan, Britney Spears, and Angelina Jolie are just some examples of famous celebrities who have also been diagnosed with this disorder. If so many people have this disorder, is there treatment? The answer is yes. While many disorders in the dramatic B cluster are highly unaffected by treatment, borderline personality disorder can be helped through a form of cognitive treatment called DBT. Also known as dialectical behavioral therapy, this form of cognitive behavioral therapy uses the concepts of both mindfulness and acceptance to control intense emotions. Specifically, psychologists focus on reducing self-destructive behavior, being aware of the current situation, and improving relationships as the key goal of DBT. While DBT has shown to be effective, due to patients' tendencies of emotional dependence and distrust among psychologists, it may require many sessions in order to see improvement. For some, it can take from months to even years. While medications are also commonly prescribed as a form of treatment, DBT has shown to be more financially advantageous than traditional medications in treating borderline personality disorder. According to the 2015 research article, The Fate of Psychological Treatment for Borderline Personality Disorder by Muldak, by analyzing and compiling the cost of treatment of over 134,000 patients, a cost reduction of nearly $2,984 per patient per year was seen when compared to the medications and treatments used today. Meaning the use of DBT as a treatment is not only more effective, but also financially cheaper when it comes to treating borderline personality today.